So, hi, Belqui. I'm Pam. Tell us a little bit about your story and um,
Well, I'm an autism mom. My son was diagnosed at around 21 months, but I knew because he was born premature. We had this issue where we just saw the differences between him and my firstborn, and I kept telling the doctor like something's not right. There's just we just and they're like, oh well, he's premature. He has to catch up. The whole thing. Oh, boys are slower and all the things that So I noticed that at 13 months. That's when I started getting a little concerned. So by the time he was 18 months, they decided, okay, let's give him a he just, what's it called again? Like when you're kind of behind, but he's developmentally behind, but it's because he's premature. And because he had a brain bleed at birth. So they thought, okay, well, everything's going to work out fine. And he wasn't saying a lot of anything. It was just blah, 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 so we knew, okay, he needs help, but no diagnoses. Then at 21 months, they were seeing him every month. They decided, let's just do the ADOS, I believe it's what it's called. And they did the whole testing, and then he came up with autism. For me, it was actually a wonderful day. It was actually a great day because after fighting for, from 13 months all the way till 21 months, telling them, it was just kind of like, okay, now I can actually get him the help that he really needs. And at 21 months was actually when he started walking. So that's really developmentally delayed if it was just that, so.
Okay. And then talk to us a little bit about some of the therapies that you tried that you really liked, some of the medicines that you may have tried that you liked, or.
So growing up, we didn't do any medication. He's 12 now, just to clarify. So what we did was a lot of therapy. We started immediately with ABA therapy, and that was at home because he was still under 3, and we lived in New Jersey at the time. At 3 is when you start going to like a preschool for kids with autism. So we started ABA at home, and it was about 20 to 25 hours a week. We did speech for 5 hours a week. So it's basically a school at home.
That's a full-time job.
Yes. And then OT and PT. And that was literally every day. A lot of it was out of pocket because our insurance wouldn't cover some of these costs. But thankfully, we were able to afford those payments. But it was basically, we went all in, and we just wanted to make sure, because the earlier the intervention, the better. And it worked out in the sense that we did see a lot of changes. Like the ABA was probably the best one because we could really see a lot of the behaviors that he was having were kind of better. He started to learn to just do, like, even if it was just like putting a puzzle together, a small puzzle, like he was able to like grab it and put it and match it, which were things he wasn't able to do before. Even as simple as look at me, there's a lot of controversy, right, around ABA therapy, but in our case, we weren't doing things that were like, you have to sit here and you have to, he was 2. So he had to run around and be happy at the same time. So we would even do ABA at the park.
Oh, that's a good idea.
So you would just go out and do things like that. And then we started doing like where we would do ABA and then speech together. So we would go anywhere, to a pool, whatever it was, and try to have both working with him at the same time. And that was wonderful. So I would say our favorite was ABA at the time. And one of the things actually that we ended up having to do eventually, as a lot of the kids have just issues with food, right? Was feeding therapy, because he started to have like even though he was eating like things like rice and pasta, suddenly he couldn't eat rice, he couldn't eat pasta, he couldn't, like, it was insane. We couldn't figure out what was going on. So we started doing feeding therapy. And even now at 12, he's still in feeding therapy.
Right.
He still has OT. He still has PT. Not ABA though.
So, and that kind of rolls into nutrition. So tell us a little bit about some of the nutrition that you think has really helped, or you've noticed, is a positive or a negative. Food, supplements, anything that you think has been helpful.
Yeah. So gut issues are obviously very common with kids with autism. He was born with the problem. Like it was from the moment he came out of me and he was in the NICU. It was stomach issues in the NICU when he comes home. He also had acid reflux, just a very colicky baby. And oh my God, that was so hard for us. So at the time, it was the medications that the doctor gave us, when he came home. And then after that, it was, as he got older, it was Miralax. And because of the issues with food, they prefer a certain texture, I guess. Right. So I hear some kids prefer like crunchy food and that's all they want, right? So that was kind of him. It's crackers, we've taught him to eat other things, but it's really all hard food. And what does that do to you? It binds you, right? And then we took him to GI. So we did a lot of GI visits, and the GIs would always say Miralax.
I know, which is so bad.
Which is so bad. Like, you're not supposed to give your kid Miralax every day. But it was Miralax every day, every day, every day, every day.
And what's happening is they're stripping their gut of the good and the bad.
Exactly. And then on top of that, then now I have to also give you probiotics. I also have to give you Metamucil. Like, it was like a cocktail of things.
Right.
But because, like I told you earlier, we leave, no stone left unturned. You try everything. Right. But as a parent, you start thinking, just because this is a doctor, it doesn't mean that they're right. Maybe this isn't right for my kid. Right. And then I myself decided I was going to take him off of those things. And I started like trying different probiotics, different things. Right. One of the things that was the first thing that worked before finding, Hello Health was aloe juice, aloe water.
I've heard about that.
Yes. So we started with the aloe water. I took him off of everything because even with all the Miralax, he was going every 5 days to the bathroom. Sometimes I needed to do, suppository or something to help him go, an enema as well. And he would be in the bathroom, like hitting his stomach and crying, the pain. But he's 12 and we just got this down. Yeah. Now at 12. So this has been 12 years of suffering for this boy who's nonverbal, can't tell me, I'm uncomfortable. And of course, when they have issues with their gut, then you see it in their behavior, right? So he just a hot mess all the time. And I'd be like, okay, I think maybe he has a stomach ache. And, he also was very gassy. So it was constant gas. So I think those were all signs. And now we're just happy to see that he's going to the bathroom almost every day.
That's good. So that's awesome. A big difference.
It's a huge difference, huge difference. And as a parent, you're just like, he's not hitting his stomach anymore. Sometimes I go to out because he goes to the bathroom by himself. He does number 1 on his own. Okay. Number 2, he now sits on the toilet and goes, and then he sits there until we realize he's messy.
Meanwhile.
Meanwhile. So then you walk in and there's there's poop in the toilet. Sometimes he will flush it, but he takes his pants off all the way. Yeah. And that's the sign that he pooped. You get to know your kid. Things. Exactly. No, so it's just good to finally have like relief and feel like, this is not going to be a burden for him for the rest of his life because it's just starting.
Are there any other natural things that you've found are amazing for him and his health and his mood or anything, sleep or anything that you would recommend?
Not really. We've tried so many things, for him to sleep, but I think as he's gotten older, I think he's just better, right? Yeah. So we even tried CBD and things like that. And it's like, it didn't work for us. No. Okay. So for us, it's more, it's just letting him out. Obviously the stomach issues, that's something that you don't necessarily outgrow. But when it comes to behavior and sleep, especially, he's just so much better now. Like in the morning, I can't get him out of bed.
That's an improvement over where we were.
Well, yeah. And before, like it was, he would be up at 3 a.m. and not sleep again, or be up till midnight and then we couldn't get him out of the bed. Like, it was just this crazy, and it affects you as a parent because you're exhausted, and now you're having to give, Now
that you're using probiotics and you're finding that he's using number 2 on a daily basis, or almost daily, do you find that that's also affected his brain or his mood or his happiness or anything? I mean,
absolutely.
Yeah,
Absolutely.
It's really wild how we're starting to figure this all out, I think.
Exactly. I agree. It's like there's definitely a correlation there. Yeah. And I never put myself in his place until I had to get my gallbladder taken out. And I was on anesthesia and all of that. And, it binds you. It and for some reason, this was the one time that I was under anesthesia where it really affected me, where I couldn't really go to the bathroom. And I was so uncomfortable. Yeah. And I kept thinking, oh my God, like, this must be how he feels or felt, like, every day, like this uncomfortableness. And, I was moody, you know, so imagine if you can't go.
Yeah, day in and day out.
No. So,
Well, thank
game
you.
Changer.
Thank you for sharing your story.
No, thank you. I'm here to tell my story. So I want, everyone to be able to have the ability to help their child the way that I'm able to. So
fantastic. Thank you.
Yeah, you're welcome.